the person, individual, can he practice, follow Ayurveda along with other medical science?
The emphasis of Ayurveda is to do the root cause treatment so that the disease should not reoccur again. The most important part of Ayurvedic treatment is about the detoxification.
The modern medications and Ayurvedic medications will not have opposite effects on the body together when parallelly practiced.
Ayurvedic medicine, when it goes inside the system, so it stimulates the organs and it makes it function normally, and that's how it corrects the system.
Why one should choose Ayurveda? How Ayurveda is different from other medical science, and the person, individual, can he practice, follow Ayurveda along with other medical science nowadays?
As I mentioned earlier, Ayurveda is not just meant for the disease management, right? Okay. So, for the wellness, there are so many things one should do. Now, when we talk about disease management, if somebody is suffering from any kind of illness, why and when Ayurveda should be chosen is a question. First thing is, as I mentioned, Ayurveda, but the formulations or the medicines of Ayurveda are in the form of herbal medicines. They are purely organic. Second important thing is, the emphasis of Ayurveda is to do the root cause treatment so that the disease should not reoccur again. Third is, whatever treatment we are doing should be completely side effect free. I mean, when I am treating a disease, that should not cause or give rise to some other disease, yes, right? Yes. So these are the peculiarities of the Ayurveda. Now, more than that, the most important part of Ayurvedic treatment is about the detoxification. So, which completes the treatment protocol, and after the completion of the disease treatment, Ayurveda doesn't stop there. Ayurveda always advises to do the maintenance of that, so that you should not suffer from that disease again and again in later time. So these are the specialities of Ayurveda. And as you asked, whether it can be followed parallelly with the other yes, medical sciences. Of course, I mean, in terms of Ayurvedic diet, in terms of lifestyle, it can be followed with the other medical sciences. At the same time, even in terms of Ayurvedic detoxification treatments or medicines, that can also be followed parallelly with the other systems, when only Ayurveda is not capable of taking care of particular disease. For example, when we treat cancer, we don't treat it only with the Ayurvedic medicines. We treat it along with the ongoing modern treatment. For example, if the person is undergoing the radiation or completed the radiation and undergoing the chemotherapy, there are the phases of the treatment. Like along with that, there are set of medicines which has to be taken, so that person should not get suffered from the side effects of the radiation and the chemotherapy in the near future as well as in the later time. So if we see about it, so that is required. Ayurveda can be followed parallelly along with the other systems. At the same time, even in chronic cases like diabetes, in the initial phase, diabetes cannot be controlled immediately only with the Ayurvedic treatment. It also needs the support of the modern ongoing treatment, whatever is going on, and gradually that has to be tapered, and then the patient can be maintained only with the Ayurvedic treatment. So there is no harm in following Ayurveda parallelly along with the modern medical science.
I have a doubt, like, sir, the modern medications and Ayurvedic medications will not have opposite effects on the body together when parallelly practiced.
Yeah, it's a very good question. See, basically Ayurvedic medicines are not a supplement. There is no concept of supplementing in Ayurveda. So what Ayurvedic mode of action of Ayurveda is always stimulating the internal organs and making the organs self-sufficient to secrete its chemicals, its enzymes, and function the entire system of the body normally. So that is the thing. So Ayurvedic medicine, when it goes inside the system, so it stimulates the organs and it makes it function normally, and that's how it corrects the system. So that is how over a period of time, in most of the diseases, our system doesn't get dependent on the medicines, because once the organ is corrected, so it can run on its own. And see, what does Ayurvedic medicine contains? It does contain herbs,
Yes,
right?
sir. Yes.
It does contains very common things like ginger, like lashun, right?
Yes.
Jeera, all these things which we use in our kitchen, right? They are also available in our medicines, right? So, do you ever think that when you are taking any chemical medicines or synthetic medicines, whether it has to be consumed with the food or not?
No, sir, no.
Because it will not, I mean, interact with that, I mean, in a adverse way. Even if it interacts, it will be a positive effect itself. It will enhance the action of each other. It will not deplete it. So that is the thing.
In earlier days, the modern technologies which are available now were not available at that time, sir. So, how the acharyas used to diagnose the disease and used to plan the treatment for the patient?
So in Ayurveda, there are three methods of diagnosis. One is Darshana, Sparshana, and Prashna, right? Darshana is perceiving all the information, all the knowledge about a patient with your sense organs, like watching or observation, then smelling, then touching, at the same time hearing sounds, right? So now, what are the modern tools and the equipments which are helping us for the diagnosis? These are the extended versions of the sense organs. For example, if I want to hear heartbeats, right? Earlier, probably our ancestor used to put their ear on the chest, but now I can hear it clearly with the help of stethoscope, right? So that's an extended version of my sense organ of ear. So likewise, when we see the X-ray or MRI, they are the extended version of our vision. We can see inside the body. So though they are the technologically advanced tools, they are the extension of our sense organs. This is what is the first line of diagnostic method Ayurveda has told, that is Darshana. Second is Sparshana, that is touching a patient, right? So touching the abdomen, palpating the abdominal organs, then seeing the tenderness, where the pain is, where the movements are, whether the movements are normal, whether there is a rigidity in the muscles, whether there is a pain in the joint. So all that can be done with the help of touching, that is Sparsha. Third is Prashna, that is detailed history of a patient. Detailed history in the sense, why one has to do a detailed history, that is to understand a root cause of a disease, whether where the exact cause is lying. For example, if somebody is suffering from a liver disease because of the alcohol, or because of the stress, or because of the wrong lifestyle. So unless and until I understand the detailed history of that patient, I won't be able to come to the conclusion. At the same time, I have to go back in the history of that person about the past illnesses. What kind of illnesses he has suffered in the past. For example, somebody has got a trauma to the back, and now he is, after 10 years, he is suffering or she is suffering from the back pain. So that can be one of the reason, which is in Ayurveda it is called as marmaghata, right? So there are so many things which are linked to each other. I mean, I'll give you a simple example. The people who has suffered from various kind of viral infections which are severe, like dengue, malaria, dengue, chikungunya, they do suffer from the joint pain in future. So which is called as a reactive arthritis, right? In many of these patients, uric acid level gets increased. So This is what is seen. So that is why we have to understand the in detail past history of the illnesses. At the same time, what is the diet habit of a person, what is the lifestyle, what kind of occupation he is having, whether the person has to stay more time in the sunlight or in the cold climatic condition or in a rainy conditions. So all that will have impact on our health and the body. So that has to be considered, and on the basis of that our treatment is designed. I mean, there would be importantly two kinds of treatments. One is which is targeting on the cause, root cause, and second is which is targeting on the existing disease. So once we parallelly target both these things, so the disease will be completely cured and then there won't be a reoccurrence. This is what Ayurveda is famous for.
You all liked today's video, and I am sure that you got benefited from today's discussion on the topic Ayurveda. And if you want to have more information, you can go to the website tapasyahealth.com, which have been mentioned in the description below, and you can also contact to the office number mentioned below. For more such interesting information, please subscribe to our channel. Thank you.